Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is June 12, 2025. This video is on a BMJ article published on June 4, 2025, titled P2Y12 inhibitor or aspirin after PCI, individualized patient data meta-analysis of randomized clinical trials. There was an accompanying editorial titled Antiplatelet Monotherapy after Percutaneous Coronary Intervention. PCI is the most common revascularization method for coronary artery disease. DAPT, that is dual antiplatelet therapy with aspirin, and a P2Y12 inhibitor is standard post-PCI protocol. After DAPT, aspirin has traditionally been continued, but recent trials suggest that P2Y12 inhibitors may be preferable. In this study, individual patient data meta-analysis from 5 randomized clinical trials. The study cohort comprised of 16,117 patients, mean age 65, about 23.8% were women. Follow-up duration was a median of 1351 days. Patients were from Europe, North America, and East Asia. 55.5% had a prior history of ACS. Analysis: mixed effects, Cox model, one stage, multivariable adjustment, and two-stage random effects models. The outcomes included major cardiovascular and cerebrovascular events, which is the primary, major bleeding, co-primary, net adverse cardiovascular and cerebrovascular events, and individual ischemic and bleeding events. What did they find? They found that major adverse cardiovascular and cerebrovascular event risk was lower with P2Y12 inhibitor, hazard ratio 0.77, p-value 0.001, number needed to treat 46. Bleeding risk, no significant difference in major bleeding, p-value 0.35. Net adverse cardiovascular and cerebrovascular events was significantly reduced with P2Y12 inhibitor, hazard ratio 0.86, p-value 0.03. Myocardial infarction and stroke were reduced with P2Y12 inhibitor. For MI, the hazard ratio was 0.69. For stroke, it was 0.67. For both, the p-value was less than 0.006. Mortality, no significant difference in cardiovascular or all-cause death. The key takeaway: long-term P2Y12 inhibitor monotherapy post-DAPT reduces ischemic events, notably myocardial infarction and stroke, without increasing major bleeding versus aspirin. In the accompanying editorial, the editorialists say that P2Y12 inhibitor reduced major adverse cardiovascular and cerebrovascular events by 23%, myocardial infarction by 31%, and stroke by 33%. No significant difference in major bleeding overall. In their opinion, P2Y12 inhibitor shows promise as preferred monotherapy post-DAPT, but heterogeneity and geographic variation warrant caution. The key takeaway was P2Y12 inhibitors, especially clopidogrel, may outperform aspirin in long-term secondary prevention after PCI without added bleeding risk. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.